alive. No, I don't mean that in a broad sense. I mean that in a very narrow personal sense. Voila, this is my rinky-dink nebulizer. And I am back to using my nebulizer all the time because I have asthma playing up, which is not abnormal. There's nothing abnormal about it if you were born with it, as I was. But here's the thing. I'm terrified of ending up in a hospital because all this coronavirus crazy has indicated, from what I have seen from ICU nurses and doctors who have spoken out, that the hospital is a very dangerous place to be. Now, it so happens that these issues of euthanasia and personal experiences and so on, they coincide. So I thought, let me put them all together and clue you in. Disclaimer, I am not a doctor. Consult your own medical professional. Do not take this as medical advice. Do not take this as any kind of advice. This is my own personal insight. Okay, so I am very familiar with hospitals and ICU and ambulances. I was born with asthma. It comes from both sides of my family, and I get a particularly bad strain of it, but it comes and goes. There's an ebb and a flow to this disease. So sometimes it's not so bad and it's completely controlled, and other times, like the present, it is a nightmare. So because I am terrified of ending up in hospital for reasons I'm about to explain, I have been doing the catch-22 thing. And this is where you hedge your bets by using a lot of prednisolone, also known as cortisone. That is a catabolic steroid, not an anabolic steroid. So it doesn't build muscle, it breaks down muscle. And the reason I'm doing that is because asthma is, your immune system is overreacting to something 99% of the time. And what prednisolone does is it brings down your own body's immune system. It tanks your immunity so that your immune system doesn't kill you by trying to protect you from whatever it thinks there is in the atmosphere. This is not a recreational drug. This is an extremely unpleasant medication to take. I have long-term fallout from taking it, and in the short term, well, it's mainly because you don't have an immune system, you tend to pick up bugs, colds and flus. Isn't a big deal, except now I have a little bit of a sore throat, not breathing very well. You might be able to pick up that I sound breathy. I'm actually very disciplined because in my family there was zero tolerance for illness. So the true extent of how bad my lungs are is generally well hidden because I've just had to learn to conceal it and get on with it. Now, normally, if you go through a bad spell, you might take a little bit of prednisolone, but not too much. But I'm erring on the side of caution, and I'm taking more than is necessary. And the reason for that is because, as I said, I'm terrified of ending up in hospital. Because from what I have seen of the protocols that you are subject to, and please remember, you're not allowed to have anyone in with you. You are assumed, if you're somebody in my position and you can't breathe and you have a little bit of a fluishness about you, they're going to assume you have coronavirus and treat you accordingly, which is not very well. And although I have no great attachment to this life, none whatsoever, I do have responsibilities and a great love for my animals. And so I really can't afford to simply throw in the towel. Plus, I don't really consent to being murdered. Now, why would I think I would be murdered in a hospital and not cared for? Well, first of all, doctors have already tried to kill me because the type of asthma I have is called tombstone chest. And so you generally expect an asthmatic to be wheezy, and I'm not wheezy, you just don't hear anything. And so I have been in situations where doctors have, inexperienced doctors have taken a look and gone, she's hyperventilating. It's nothing, that's not asthma. And yeah, and literally come within a minute of life and death. Very unpleasant, and it's very painful. It's a nasty experience. It's one I've endured many times, but I must get this out of the way. I would not, under any circumstances, take on the horrendous responsibility of destroying everybody's liberties to protect me from coronavirus. And I am saying that as somebody who really knows what it's like to not be able to breathe, which is, of course, the great fear people have of coronavirus, is that you die and from not being able to get enough oxygen. It's unpleasant. I'm not going to sugarcoat it. But again, just because I am on the vulnerable list does not mean the rest of the world has to grind to a halt. So not in my name. And when you go to hospital because you have an asthma attack, normally they immediately slap on an oxygen mask along with a nebulizer, and that nebulizer will contain medications, and they will hook you up to an IV, which will contain all kinds of things, predominantly prednisolone, to get your immune response down so that your lungs can function again. And by the way, the problem with asthma is not that you cannot breathe in, it is that you cannot breathe out. So as you are, you seem to be, but it's because you can't get the air out, so oxygen can't get in. One thing that they seem to be very keen on is the ventilator option. And I've been just looking at this aghast to see that everybody's saying, oh, we don't have enough ventilators, we don't have enough ventilators, we don't have enough ventilators, we need more ventilators. Ventilators aren't a magic bullet. I've never been on a ventilator. I wouldn't want to go on a ventilator. If it got to the point where it was a ventilator, well, I think that would be time to call it quits for any normal person. So again, I'm not a doctor. I'm not dispensing medical advice. Let me tell you where I get what I'm about to say from. It's all personal. First of all, in my family, I have, on 3 occasions, we've been at that point where you have to make a decision, withdraw treatment or continue. So I know the weight of that. I really do. In the second place, I briefly studied euthanasia, and and then I dumped it because, yeah, war crimes. But part of the reason why I dumped euthanasia is I could see the writing on the wall, and it was absolutely terrifying, this push to make it normal, that in circumstances where it wasn't really justified. So I'll give you a telling example. There was, I don't know if they still exist, the Hemlock Society. and a man and his wife or partner ran this Hemlock Society, and then she got cancer. And suddenly everybody was pressuring her to terminate her life in accordance with their principles. And yeah, that is not where you want to go with something like this, but it is something that has now become very normal. And yeah, so the study of euthanasia was terminated because I saw a brick wall in front of me. I I read the writing on the wall, and I realized, look, this is not. I don't have the strength to fight this. I really don't. It is so immoral and so wrong, and I can see that the narrative is so heavily focused on the way that they are going that there's no. I didn't have the fight in me. I've also done a course at hospice and worked at hospice. They actually kicked me out, and no, not because I did anything wrong. It was because they said, look, you've been through several family deaths, and I tended to become, what's the word? I couldn't cut away the people I was seeing once, like other people do. So there was no go home, shut the door. Okay, that's it. I'm off for me. And I was basically running myself ragged because I could not draw that line. And I don't fault myself for that. I will never fault myself for compassion and caring. But it does take a toll, and if you do that kind of work, then you have to be able to cut it off at some point. Otherwise, it is going to destroy you. If I had to end up in hospital right now, as I understand the protocols, they're very keen on the ventilator option. And people talk about ventilators as though they're nothing. Okay, well, let me clue you in. Do you know what a ventilator is? Do you know when they use a ventilator? A ventilator is not a nebulizer. It's not some oxygen. It's a machine that takes over your breathing for you. You think that sounds wonderful? It is so invasive and intrusive on your body that they often have to put people into comas or sedate them heavily, because the body just resists having that machine breathe for it. They also are not the best thing for your lungs. I wouldn't need a ventilator. I would need oxygen and the usual treatment, which is standard, and which I'm not seeing people really using in the case of people who can't breathe, because under the new climate of the virus, there appears to be a new approach, which let's just say it leans to the side of killing you rather than healing you. To be intubated is a harrowing experience. I've never had it done. I've seen people who are intubated, and your best reference is, that machine when you see people lying in the hospital bed and it's that sound. Yeah, the machine has completely taken over your breathing for you. Very invasive. It also doesn't really work. It is not a magic bullet. It is not a cure. If anything, in many cases, it will make things worse. The correct treatment would be to, oh Lord, there goes the neighborhood. That is what happens when you put people on an enforced lockdown and suddenly withdraw cigarettes and alcohol, and domestic upheaval begins in earnest. That is across the way from me, if you heard the shrieking. So back to the ventilator. When would you use a ventilator? Well, let's say somebody was in a car crash and they had a serious head injury, but it looked like it might be able to pull through, because what happens is the brain swells very quickly and catastrophically. That's actually where a lot of the damage is done, not the initial trauma, but the brain swelling and swelling and swelling. And so what you want to do is, that might cut off breathing, that might prevent the person from the autonomic, your sort of natural brain stem that does all that work might not be functioning correctly. So you would put somebody on a ventilator and see if that swelling doesn't come down. And if it does, well, you have used a ventilator wisely and well. They also use ventilators during cardiac surgery, heart transplants, pulmonaries, anything like that. They will, and that is for a defined amount of time. Now, I'm not saying a ventilator never works. Yes, there are some people who have scraped by and made it through because they were on a ventilator. I'm saying that in my experience, my limited and humble experience, and again, I'm not a doctor, it is very much a last resort, and really the second-hand evidence hearsay from a friend many years ago who worked as a trauma physician. One of the key reasons that doctors might put you on a ventilator if you are past the point of no return is if you are a young, healthy person and they might want to harvest your organs, because there are organs which can hang in there for a little while, and then there are organs which you have to harvest them fresh. And that is a grotesque word, but that is the medical term used, harvesting organs. Now, the thing about people being unconscious is you don't actually know what they can hear and what they can see, the mind's eye. You don't actually know how much they feel. And they certainly do not administer any anesthetics or medications to dull the pain or something if they are harvesting your organs. You might have heard of a phenomenon where people have operations and the anesthetic is strong enough to keep them paralyzed and apparently sedated, but not strong enough that they do not experience every single second of that surgery, and there's nothing they can do about it. Absolutely terrifying idea. And we know, you can go and look it up, that people in comas who do recover very often can remember in detail everything that was said around them, everything that went on around them. But of course, to the naked eye, it would appear that they were unresponsive. So with that in mind, just be aware that if this is you or your loved one, you might want to think hard about those options. Now, this comes along with this do not resuscitate order, which has become very, very popular. And in fact, they are asking elderly people to sign it. They are asking people with kids who have mental disabilities to sign. Everybody is being asked to sign a do not resuscitate order. And I really have to wonder. Now, at this point, I just want to explain something to you about euthanasia. There are broadly two forms: hard euthanasia and soft euthanasia. So hard euthanasia is where, like in the Netherlands, they held the elderly woman down and administered a lethal injection because they had decided her life was not worth living. Or you perhaps have gone to the Dignitas clinic in Switzerland or similar because you have a horrendous disease and you just cannot bear to live with it anymore. And you know what? Fair enough, that is a very individual choice, but it should always be made on an individual level where the person is fully aware of what they're doing. There is an argument that if a person is cognitively impaired and very sick and without family to look after you, and in a care home where they aren't all that compassionate, to say the least, perhaps, and this is where we get to the point where we have just lost our moral compass as a society worldwide, where perhaps it is kinder to put people out of their misery. And in fact, this is exactly what people have been doing. There were all kinds of reports coming from Spain. One person was fervently reporting on that, where they described how they were taking elderly people off ventilators to give them to younger people, and then giving the older people a drug called Rivotril or something similar, which is it's some sort of a tranquilizer, but the point and the dosage over here would be to end their lives quickly and painlessly, which is fine if you have a God complex and you think you can do as you like and you have absolutely no reverence for life. And by the way, this thing about the hysteria, oh, they had to take elderly people off the ventilators to give them to new people. Okay, well, back again to the fact that there isn't a very high survival rate anyway off of ventilators. So that is not so much a function of any, what appears to now, they are telling us is going to be a seasonal infection. It is more a function of reality that simply ventilators are a last resort. And if you're at the point where you're going to go on a ventilator, your chances of survival are already low. So it is not a cure. It is not a cure. It is not something you would want to voluntarily go on. When they talk about we don't have enough ventilators, they are talking absolute nonsense. There are plenty enough ventilators. When they talk about having to take older people off ventilators, probably because those older people are beyond the point of no return and may well have been sent there by aggressive treatment, again, just my opinion, as opposed to gentle oxygen being given at a gentle but enough pressure to get into your lungs and do some work over there, and all the other steps you take to ensure that somebody can breathe. Soft euthanasia is where you withdraw treatment. So you'll be treating a person, say, with chemotherapy or whatever for cancer, and then you get to a point where it's just not doing anything. And at that point, usually you will have discussed that well in advance. You stop treating that person. And let me explain to you how much I mean you stop treating that person. If somebody who is elderly, their late 70s, early 80s, frail, has been on a lot of chemotherapy, simply not responding, they will be very immune compromised. They will be prone to infections. And so if they got pneumonia or a lung infection, instead of going gung-ho and treating that aggressively, you would allow nature to take its course. Now, I can't tell you, I can't begin to emphasize how important it is that you have a moral compass about what is right and wrong, and a reverence for life, and really the fear of God in you, because these are very serious things. Anybody can extinguish life. Getting life on the go again, not so easy. In the case of my grandmother and my mother, in both cases, a decision was made to withdraw treatment. And before you say that sounds cold and awful, it was my grandmother's own decision. She got to a point and she said, and we had discussed this in our family a great deal, because it's one of those things we've had to live with. And she said, that's it, no more treatment. And I said, do you want me to call up hospice? And she said, yes. And there's nothing easy or painless about that decision if you are the onlooker, because you have to stand there and watch the life draining out of somebody, and there's nothing you can do about it. So it's not a decision you take lightly, although so many do. In addition to this, it gets a little bit more complex. So once my grandmother was in hospice, and I did not leave her side in the 4 days that she went into a coma and died, you also have other options. So one other option is, if the person becomes restless or appears to be in pain or anything like that, the doctor can administer extra morphine and sedatives. But the downside of extra morphine and sedatives is that it shortens your life, because it slows your respiratory system down, your breathing slows down, you're getting in less oxygen. So it'll shave a day or so off your life, somewhere around there. We're not talking about lethal injections, we're just talking about the amount to stay comfortable. And that was another decision I took. And as I say, in my family, this was discussed. And so I knew the situation. However, what I would not do is have ordered the injection that ends it right there, under no circumstances whatsoever. Although that's not to say that those circumstances don't exist. So another case of soft euthanasia is my mother had a brain tumor, and then towards the very end, well, it was just so ginormous and she was going into a coma, and she ended up in hospice. They were wonderful in those days. Now, let me contrast, because there was another woman at the hospice at the same time who also had a brain tumor. So let me contrast for you hard treatment programs versus withdrawing treatment, so that you can fully understand how grave this issue is. With my mother, there was no question of ventilating, putting oxygen on, feeding tubes, nothing like that. When you are terminal and close to death, your body shuts down. You stop eating, you stop taking in nutrition. This is the normal course. It's almost like, how do you put this? Labor, labor to give birth in reverse. The body slowly shuts down, and a lot of your body resists shutting down, which is why it can be very traumatic to see somebody in their death throes. However, you have to understand the situation, and you have to have some sort of a spiritual understanding. I don't think it's possible for a flat-out atheist to really, in all good conscience, make this decision by themselves if they don't believe that there are any consequences and that life isn't anything more than an accident. Well, I actually, no, I can't speak for you because I don't know, I don't understand you. You are operating from a paradigm which is alien to me. But anyway, the German woman who was also there with a brain tumor, her husband had insisted on putting up the hydration and the feeding drip and so on. And so she was there before my mother came in and quite long after. Now, what was particularly enraging about this is that the husband was doing it by the book, you know. Of course we will give her hydration, of course we will keep her going. But he didn't visit at all. He would come in for exactly 10 minutes. He would sit with the kids over there. And it was absolutely pitiful in between watching her crying for her children, crying for her family, because she was from Germany. There wasn't close family around. And this feeding tube and hydration, which is simply counteracting the natural shutdown process of your body as it approaches death, which is going to happen to all of us. You know, it's this, you aren't special because you've got a smartphone. This is the circle of life. Yeah, so he kept her going artificially. Do you understand? There's a difference between allowing somebody to die naturally and artificially prolonging their lives. And when you interfere with the body shutting down by no more liquids, no more food, withdrawing from life, you are in fact prolonging the agony. And it was quite one of the most horrible things I've ever had to see, was that woman hooked up in hospice because she was dying, but he kept her going, you know, by the book until the very end and did absolutely nothing more for her. And that has left a very, very dark impression on me. So there is a point at which you have to say, when do you sign a do not resuscitation order and when don't you? Now here's the thing, DNRs are not always due to accidents or terminal illness or something like that. They can happen from cardiac arrest, and you can resuscitate that person and they can go on to enjoy many more years of you know, life, real life, as opposed to just getting by. So it's very disturbing to me that this DNR has become so ubiquitous and normalized. Now, if you just cast your mind back, not even very far ago, there was a huge problem with people getting, say if you were in the United Kingdom, to get permission to go to Switzerland to be euthanized was against the law. And it was against the law, not permission. And so family members were subject to being charged as criminal accomplices to murder, or all kinds of things. And overnight, that whole policy has just gone out of the window and DNR has become standard. So they aren't resuscitating people, not just with the infection, but anybody who codes. I saw in New York City that the policy was now anybody who went into cardiac arrest, do not resuscitate. That's insane, because a lot of people go into cardiac arrest, and as I said, they recover and they live fruitful lives. So this do not resuscitate order, it should come very much from the patient themselves, and it should never, never just rest on a whim. The other very disturbing aspect is the Liverpool care pathway that they have in the United Kingdom. Now, it's one thing if you do not hook up somebody who is already in a coma to hydration and feeding tubes. So they have gone from the point where they are conscious and now they are unconscious, and it's just the life is ebbing out of them. But let us look at the scenario which has become very common. Somebody who is elderly and poorly, and it might not even be a big thing, it might be a minor infection or something, is now the doctor, the staff can put a DNR, they can slap it on above their bed. And so people who are completely conscious, people who are not in that final terminal phase, are deprived of food and water, and they die starving and dehydrated, which is murder. That is murder. I hope, because there are no easy answers. In my family, every time this happened, we had a clear sense of direction. We had spoken about it. There was consensus, and we all had the same value system, which is, you simply do not cut life short gratuitously. It's another thing when you have extended and prolonged treatment and you've already gone past your normal lifespan. And then you decide no more. And I really hope people can understand that the process of your body shutting down, which for many people will go into a coma, and slowly the rejection of food and water is part of the death process. It's part of the labor in reverse. So there's a massive difference between somebody who is now at that point and denying food and water to somebody who is conscious, asking for water, asking for food, and because the medical personnel have put up that sign, they aren't allowed to have it. It's all very disturbing because now you aren't allowed into hospital with your family. It's also cut off, so you have nobody to advocate for you. And yeah, this is why I am putting myself through really hell, because there's also a cost factor. Nebulizer meds are expensive. Prednisolone is cheaper. So I am on this regime of really too much prednisolone to prevent me from having to be in a position where I might need to go into hospital for what is a very normal asthma attack, which I have been through many times before. And the hospital staff, because they have been primed to do so by all these directives, take one look at me and decide, COVID, ventilate, deny treatment. Again, I'm not particularly attached to life, but I really do rather prefer not to be murdered. And yeah, these are difficult things, but these are things which you must have in order. And as a society, the time is now to decide how much you have a reverence for life. Because if you snuff out life gratuitously, if you treat the elderly and the sickly like basically yesterday's rubbish to be thrown out, then that doesn't make it easier for everybody else. That is poisoning humanity. It is poisoning our entire society. It is a horrendous indictment of our materialistic value system, where something has to be perfect, useful, completely materialist world, or you just throw it away. And I want to end with this. People are absolutely terrified of dying. Now, this has generally always been the case. However, in the modern world, we have divorced ourselves from the death process more and more. So people used to die at home in their own bed. Family doctor used to come around. In some countries, it was normal to hold a wake where you have the deceased in their coffin in Ireland, and friends and family gather round and sing songs and tell stories and celebrate that person's life. Most modern people would absolutely collapse. They haven't seen a dead body. The idea of death is something that if it might happen to them, it's not, it will. And death is ugly, and they don't want to face it. They don't want to face their own mortality. So they don't want to know about this. These things must happen in hospitals, away from view. You must not worry about your elderly family. If they pass their sell-by date, just cut them off and move on, because nothing is more important than living your life. But so there is a terror of getting an infection and dying, which is completely disproportional to the risks involved. And this is not out of a reverence for life. This is out of a complete moral failure. You have so completely morally failed that you think that your right to be protected from dying from an infection, because everything else is still on the table, supersedes other people's right to liberty and freedom of movement and all the human rights we are all entitled to enjoy. Well, it doesn't. It doesn't. And by the way, while this is going on, there are people who are not getting treatment and who are dying from treatable, preventable conditions. I was due to go for surgery for my ulcers, and that got cancelled to keep beds open for COVID patients. And I'm not very happy about that, and I know a lot of people in my position. So I'm sorry if this has been a little bit haphazard. If you can't tell from my haggard appearance, I am not feeling good at all. I never responded well psychologically or physically to prednisolone, but it's that or risk an admission into emergency at a hospital where I don't know what the hell they're doing right now. They could be doing absolutely anything, and I'm not prepared to put myself in that position. Okay, everybody, if you have any thoughts, let me know. This is a macabre topic. I actually do have an even more radical story from my own family and from my own personal experience. And what can I say? Because death has been a constant companion, so many people have died along the way. I've known so many people my age who died young in wars and so on. I always wanted to face this demon head on. I didn't want to hide from it. And it's part of life. It's part of the process, spring, new leaves on the trees, Summer, fruit grows. Autumn, you start to harvest. And in winter, all those leaves die and fall off. And that is not an end. That is a prelude to a new beginning. So, yeah, let me leave it there for now. Thank you for listening.